It is a huge privilege to lead our nurses, midwives and allied health professionals who are committed and passionate about seeing every patient receive the standard of care we would all want for ourselves and our loved ones. They form the largest part of our workforce and provide high quality, safe care to our patients 24 hours a day, 7 days a week. This strategy's primary aim is to provide care that delivers the best outcomes and experience for our patients. I invite you to hear from our staff and understand what this strategy means to them in their day-to-day roles.
Recognizing that there was a gap in career progression for ethnic minorities, I was offered the chance to join the NHS Leadership Apprenticeship Programme. This is teaching me to be a strong, compassionate, open, transparent and inclusive leader.
Compassionate and strong leadership in my daily work is about creating and developing AHP support workers to be the best they can be. In my role, I want to empower and promote the valuable contribution of support workers within the Trust and for their voices to be heard.
For leadership to be compassionate, it must also be inclusive. As a retention midwife, I work with staff from early career through to late career, alongside other midwifery leaders promoting an inclusive work environment, an open and honest culture and providing holistic support for our diverse workforce.
My role is to ensure that our clinical support workers are trained to a high standard so that they are competent to assist healthcare professionals to deliver the right care at all times to improve patient experience within our Trust.
My role is to ensure that international nurses and midwives are up to date with their training and that they feel confident in performing their roles in delivering patient care. I also ensure that their trainings are up to date and that it meets the requirements of the Nursing and Midwifery Council.
I support and guide newly qualified graduates, for example radiographers and therapists, in their preceptorship year. The staff I help include all allied health professionals, nurses and midwives to develop themselves and their career to provide the best patient care.
My role is to provide rehabilitation and specialist equipment to enable individuals to return home. As well as this, I put them in touch with other organisations and services that will help maximise a person's independence after they leave hospital. By doing this, I ensure that the patient and their families have their fundamental care needs met.
As a patient wellbeing worker, I'm at the forefront of delivering care to some of the most vulnerable patients on the Forget-Me-Not unit. This unit specialises in caring for patients with dementia who can find the hospital environment intimidating and frightening. It's a privilege to be able to support them in all aspects of the care during their stay.
My job is to ensure that high quality, safe care is delivered to vulnerable patients within the unit. As the lead nurse, I am accountable for the standards of care within the Forget-Me-Not unit. I'm passionate about the care delivered to patients who live with dementia and believe that every patient should be treated as an individual with their care needs reflecting their individuality.
As lead nurse in the Dudley Clinical Hub, I manage a team who take referrals from GPs, care homes and the ambulance service. Our aim is to avoid hospital admissions for patients. We have weekly improvement huddles which allow us to learn from each other's experiences, and we also encourage staff to complete a monthly survey to identify where improvements can be made.
As a maternity team, we strive to ensure we listen to all our staff groups, the women we care for and their families to get to the heart of the ways that we can improve our service. We learn every day in every situation, and it is vital that we use all voices to influence our improvements. All members of the team are key to finding the solutions and creating a culture of continuous improvement and learning.
My role is to assess and treat patients with speech, language and swallowing difficulties. In speech therapy, listening and responding to patients' wishes is important so that we're able to tailor therapy to their needs in everyday lives. Listening to colleagues' development needs is also really important. As a team, we hold regular learning sessions to ensure we're staying up to date with current research and best practice.
I'm privileged to lead the Own Bed Instead team. This is a relatively new rapid response therapy service which was developed to improve quality of care and safety for our patients, preventing unnecessary admissions into hospital. Supporting and assessing patients in their own home provides better outcomes and experiences.
As an operational lead, I ensure the team have the correct clinical support, resources and equipment to enable them to provide high quality of care to patients within the Dudley Borough. It is my role to empower the staff to have a voice, enabling them to make improvements within the service so that the patient can receive the right care at the right time in the right place.
Radiographers protect patient safety by adhering to regulations that govern the way we work. This reduces patients receiving unnecessary or excessive exposure to radiation. The imaging department has adopted a continual feedback system to help maintain quality standards. Radiologists who write the imaging reports provide a constructive feedback for continuous professional development days.
Our NHS Blood Test Centre in the Maryhill Shopping Centre has been designed to improve patient care and allows patients to get a blood test in a non-clinical setting while they do their shopping. There is ample free parking with long opening hours 7 days a week, which results in more appointments per day and leads to a better patient experience.
Maternity services are breaking grounds by promoting international recruitment and staff retention, ensuring professional growth and development, implementing sustainable changes and embracing digital technologies in order to build and promote a great workforce for the future.
Our nurses, midwives and AHPs are front and centre to delivering greener and more sustainable care. I support them to champion sustainability to deliver on our Trust's Green Plan. Reducing unnecessary glove use, going paperless and reducing waste will all contribute to us getting to net zero.